side event on women, drugs, and development. Welcome. Just let me say a few words about Dianova. We are an international NGO operating in 11 countries in Europe and in the Americas in the field of education, youth, addiction treatment and prevention, and social and community development. The topic of women is at the forefront of Dianova's policies. We are strongly committed to advocate for women's empowerment, access to education, to combat discrimination, and also we advocate to take into account gender perspective into drug policies. We work at the grassroots level and at the advocacy level. At the grassroots level, for instance, one of our main best practices in the field of addiction treatment is that we have 37 facilities where we offer more than 20 programs, one of those being for women with or without children or pregnant in Dianova, Chile. In that center, in those programs, we have a capacity for 50 persons, and the main advantage is that we incorporate the woman's children into the treatment. So we're promoting as well parental care and bonding. Also, while doing the addiction treatment program in Dianova, Chile, we provide them vocational training, and also we provide them knowledge on gender-related issues, such as, for instance, how to uphold on children's rights or how to combat gender violence. For the advocacy level, we have been very active, especially in the preparatory process of the special session of the United Nations General Assembly on the World Drug Problem, which you might know by the name of UNGAS. We've been participating in roundtables and organizing seminars or side events such as this one at the UN level and at the European Union level as well. And to this regard, I also wanted to tell you that I left some copies of the CSW declaration that we sent this year regarding this topic, and where we have set a list of recommendations from Dianova for CSW. So they're in the entrance. So the commitment to leave no one behind is one of the central pledges of the Sustainable Development Goals. But unfortunately, when it comes to the use of drugs and alcohol by women and girls have somewhat been left behind because they have not been regarded as a population with special needs. That's for this reason we wanted to organize this side event, because also we believe it is the right timing and it is the right setting for doing that. It is the right timing because, as I said, this year UNGAS will take place in New York between the 19th and the 21st of April. And this will be the highest level meeting regarding the world drug problem in the years to come. And this will give us an opportunity to have in-depth discussion on the world drug problem, on how drug policies, on what works, what doesn't work, and then how to better implement policies to address those needs. Also, it is the right setting because CSW allows to look at gender issues with different eyes from a transversal perspective. And we believe that talking about this today can increase its visibility. Also, to this regard, I would like to share with you that I was last week at the Commission of Narcotic Drugs in Vienna, and I was pleased to attend a series of side events concretely on this issue. So it is slowly getting into the political agenda. Well, with this, it is my pleasure to welcome today's speakers that represent different stakeholders involved in improving the situation of women suffering from substance abuse or who have been subjected to criminal proceedings for drug-related offenses. The panelists will give us an overview of the situation and the best practices on how to improve women's health and development. Just a small notice, I would particularly like to thank you for being here, because it's very unfortunately that this year the Commission of Narcotic Drugs and CSW days have overlapped, and also that the end of CSW coincides with Eastern holidays, so this has driven up the cost for us to come here. So thank you for being here. Well, this being said, I would like to introduce Yu Ping Chan from the United Nations Office on Drugs and Crime, UNODC. She is the Special Policy Advisor at the UNODC New York office. Among others, she monitors and reports on matters on world drug problems, and she represents UNODC Vienna headquarters in intergovernmental and intra-United Nations system discussions in New York, and also works with other stakeholders such as civil society, the media, and academia to promote UNODC interests. Prior to working to UNODC, Yuping was a diplomat for the Singaporean Foreign Office and also worked at the Ministry of Foreign Affairs of this country. So, the floor is yours.
Thank you. Thank you very much, Lucia, for that introduction. Good morning to colleagues, well, good afternoon, I should say, and thank you so much for taking time to spend your precious lunch hour with us to discuss what I think is a very timely, important issue. I think Lucia very clearly spelled out why this year is particularly important, given that we'll be having UNGAS in April. Perhaps some of you would be aware of this, some of you are already registered to attend and plan to be there. So UNGAS is actually a gathering of the heads of states, the member states, civil society at the highest levels to discuss this very important issue. And it is our hope that this very important aspect, the gender perspective on drugs, will come into focus at the UNGAS as well. So, as you would know or may know, one of the roundtables at UNGAS will be devoted to the issue of cross-cutting issues, drugs and human rights, youth, women, children, and communities. So that will be an opportunity for member states to discuss how a gender perspective on the issue of drugs and development is actually particularly important. Also, colleagues might know that right now in Vienna, at the CND, which actually Lucia just came back from, the member states are actually negotiating an outcome document for the UNGAS special session itself. So this will be a document that will be adopted by all member states that will outline the key issues, the priorities, the way forward on the world drug problem for the coming years. And there are a couple of very key, very important references to gender and the role of women and girls in the document. Some of them are still being discussed, but I'm happy to note that some of them have actually been agreed. So for instance, under the issue of the treatment of drug use disorders, rehabilitation, recovery, and social reintegration, there is a specific reference to how we should give special attention to the specific needs of women, children, and youth in this regard in the issue of rehabilitation, social reintegration, and recovery support programs. There are also operational recommendations in the UNGAS outcome document on cross-cutting issues such as drugs and human rights, youth, children, women, and communities. And it is specifically agreed, for instance, to ensure non-discriminatory access to health care and social services in prevention, primary care, and treatment programs, including those offered to persons in prison or pretrial, which are to be on a level equal to those available in the community, and ensure that women, including detained women, have access to adequate health services and counseling, including those particularly needed during pregnancy. So there is an awareness that the issue of women and drugs is particularly important, and that hopefully going forward we can all work together to bring even more prominence to what I think is a very important issue. So I will be open to take any questions about UNGAS and the process going forward as well. But today, for today's presentation, I thought I'd give you sort of a snapshot of the current situation, the data that we actually have collected as UNODC based on our World Drug reports, as well as our numerous technical programs in cooperation with member states and civil society organizations around the world, and then give you sort of a discussion on what UNODC is doing and some of the challenges that are being faced on the ground with regards to these important issues. So let me first sort of give you a snapshot of the data and the issue at hand. Basically, based on the World Drug Report for 2015, we've noticed that men are 3 times more likely than women to use illicit drugs such as cannabis, cocaine, or amphetamines. But women are more vulnerable than men to the misuse of prescription drugs. There are a number of factors that cause these differences in the vulnerabilities of women, and this is particularly true for girls. So I'm sure that you would be perhaps familiar with some of these factors that cause vulnerability, such as, for instance, low self-esteem, concerns with body image, the influence of peers as powerful, but expressed differently for women, as well as the possibility of sexual abuse and the fact that women and girls are often victims of sexual abuse. We also noticed that women affected by drug use disorders tend to be more vulnerable and more stigmatized than men. They suffer from co-occurring mental health disorders to a greater extent than do men, and are more likely to have been victims of violence and abuse, but they are far less likely than men to access treatment. Women often develop a hidden form of addiction, in many cases with prescription drugs, and they may then suffer loneliness, helplessness, and hopelessness, in turn perpetuating the compulsive attitude. The proportion of females, women who inject drugs tends to be rather small at the global level. However, our data in the 2015 drug report suggests that in a number of countries, the spread of HIV/AIDS among women who inject drugs is even greater than among men who inject drugs. Separately, on other statistics and interesting data that we found, the gender difference among drug traffickers is greater than among drug users. According to data reported by member states to our office, almost 90% of drug traffickers arrested worldwide in the period 2010 to 2014 were male. Nonetheless, there are indications that a number of trafficking groups make explicit use of vulnerable women as drug couriers to smuggle drugs across borders for small sums of money or to perform low-level, high-risk tasks. We've also done an analysis of the contributing factors to this, and a lot of it typically points to a combination of factors such as drug dependence, poverty, situations of manipulation, and coercion. I think based on these data, and I would also be interested in hearing about your experiences on the ground and what you've noticed in terms of the gender difference or the gender perspective when it comes to these issues, there are several important gender dimensions to drug policy that I think we all must pay attention to if we really are to address the needs of women and girls and to leave nobody behind. I want to discuss some of these very quickly and give you a sense of what UNODC is doing in these areas. I want to look at the area of health and then turn quite quickly to the area of criminal justice. UNODC advocates for the recognition that drug use disorders, and the consequences associated with it, including HIV/AIDS, hepatitis C, and drug overdoses, are public health issues that should be addressed by public health policies. This is wholly in line with international drug conventions, and UNODC fully supports efforts to increase access to evidence-based treatment and care, and to remove obstacles to this in law, policy, and practice. Besides UNODC's programs on prevention and treatment, this is also relevant in many of our cross-cutting work. For instance, our work on criminal justice, legal aid, and so forth, which I will elaborate on a little bit later. We found that women in prisons are at higher risk for HIV due to their lower economic status, their low socioeconomic background, and the reasons for imprisonment, for instance, drug use or sex work. The stigma and discrimination faced by women who inject drugs in the community and in prisons, often heightened by gender-based violence and drugs, also adds to this risk of contracting HIV/AIDS. Worse still, health services are not adapted as they have traditionally been designed for men, and overall the situation is worse for women because, for instance, prevention and treatment services are generally not women-friendly and not responsive to specific needs such as sexual and reproductive rights, nor are they responsive to the needs of the children. With regards to treatment, UNODC has been active in more than 40 countries in the context of the UNODC WHO World Health Organization program on drug dependence treatment and care. In this context, we have trained thousands of service providers to provide services that are based on scientific evidence of human rights. And the TreatNet training package that we have been using has an entire model on the provision of treatment that meets the specific needs of women. So this has been an area that we have been focusing on and have been developing sort of targeted programs and interventions such that when we are providing technical assistance and training service providers, we do emphasize the needs and vulnerabilities of women. UNODC has also supported the World Health Organization in developing guidelines for the management of substance use of disorders in pregnant women. With regard to the prevention of drug use, UNODC has some indication that girls and boys become vulnerable to starting to use drugs for slightly different reasons. This is sort of linked to what I spoke about earlier, the vulnerabilities of girls and women. We've also some indications, though the data has not been very robust and we only have sort of limited reporting data, that not all drug interventions and programs have the same effect on girls and boys. So it seems that from the little data that we've collected, family programs seem to be those that have more consistently as good effects for girls as for boys. And we have a large program based on family-based prevention that has piloted some evidence-based programs in many countries. At the country level, UNODC has implemented specific projects for women who inject drugs in the community and in prisons in Afghanistan, Pakistan, and Ukraine for HIV gender-responsive approach among women who inject drugs. UNODC has also published specific guidance documents on HIV women and those who inject drugs, as well as on HIV and women in prisons. So we've been working on this area for a while, and we hope to work with all stakeholders in further improving our coverage of what is a very vulnerable group that we really need to respond to in order to effectively address the problem. I also want to spend some time discussing the issue of criminal justice. So this is also a big aspect of UNODC's work, and we find this to be a very good way of marrying what we focus on in terms of the drug policy, as well as our broader work in criminal justice as well. Female offenders and prisoners, especially those with drug use disorders, face particular hardships because in many instances, criminal justice systems are just not equipped to handle the special needs of women. In addition, in many countries, women who are imprisoned for drug offenses make up a very large proportion of the female prison population. Moreover, the imprisonment of a woman has often a detrimental impact on many other persons, beginning with family members, children, and the elderly, who the woman is often the one who has been taking care of these other family members, and the community at large. And in this regard, the use of alternatives to imprisonment is particularly appropriate for women that are charged with minor drug-related offenses. And this is something that UNODC has been working on, the alternatives to incarceration and imprisonment. So further from that, there are also a lot of negative repercussions on women drug offenders, which are very profound. Laws and policies, for instance, disproportionately affect women, including those affect women who indicate drug use as a criteria, because sometimes drug use is used as a criteria for the loss of child custody, for abortion and so forth. So these are quite problematic, and we've been working in this regard. Policies such as drug user registration, for instance, further discourage women from accessing services because the registration can lead to a loss of child custody. In some countries, laws and policies require women to have permission from family members or spouses to access health services. So these are sort of problematic areas that I will be interested in hearing colleagues' views on how we can work together to address a lot of this. So what has the UN and the UNODC done in the area of, for instance, alternatives to incarceration and imprisonment? In the year 2015, it was the 25th anniversary of the UN Standard Minimum Rules for Non-Custodial Measures, the Tokyo Rules, which is a set of standards and norms that was unanimously agreed upon by member states to complement relevant legally binding instruments. They are particularly relevant to the implementation of the provisions of the International Drug Control Conventions concerning alternatives to conviction or punishment for drug offenses such as treatment, education, or social reintegration. More recently, these Tokyo rules have been complemented by the United Nations rules for the treatment of women prisoners and non-custodial measures for women offenders, which is also known as the Bangkok Rules, and by the United Nations Principles and Guidelines on Access to Legal Aid in Criminal Justice Systems. So the Bangkok Rules specifically focus on the role on what has to be done with regards to women prisoners and lays out a series of, shall we say, standards that would be important. They provide guidance in relation to female drug offenders. For instance, they acknowledge the need for specialized treatment programs designed for women substance abusers in prison, as well as in the community. They stress that community-based programs are needed both for crime prevention as well as for diversion and alternative sentencing purposes. They also require the development of gender-specific options for diversionary measures, as well as pretrial and sentencing alternatives, which should be implemented wherever appropriate and possible. They also promote flexibility in sentencing and discourage mandatory minimum terms. So when sentencing women offenders, the courts are asked to have the power to consider mitigating factors, such as the lack of criminal history and the relative non-severity and nature of criminal conduct in light of women's caretaking responsibilities and typical backgrounds. So the Bangkok Rules do take into account the fact that a large number of women offenders worldwide are imprisoned for minor drug-related offenses as a result of what I spoke about previously, manipulation, coercion, and poverty. In fact, also, some member states, some countries around the world are also reviewing the penalties for drug trafficking offenses with a view to ensuring that there are differences applied to the sentences that major actors of drug trafficking sentences versus small carriers, the mules, which are disproportionately and many times women. So for instance, Costa Rica in 2013 has a law 9161, which reduces the sentences for women who smuggle drugs into prisons. It allows the courts to consider in sentencing and in decisions on alternatives to imprisonment a number of gender-specific circumstances, conditions of poverty, vulnerability, and caretaking responsibilities. The other issue that is separate but related is this issue of legal aid. And UNODC promotes the recognition that the right to an effective provision of legal aid is critical to those who might actually have no means to afford their own criminal defense. Access to legal aid at the early stages of contact with the legal system and the criminal justice system is important because this is where decisions are made about prosecution or diversion. So UNODC has done work, for instance, in Kenya and in Liberia in training public defenders so as to promote the important idea that legal aid should be made accessible as far as possible, and it's important to ensuring that everybody has full access to the legal resources available to them. I think moving ahead, looking at the bigger picture, it is important to take more of a gender perspective on the issue of drugs. Unfortunately, research guidelines and training programs concerning people who use drugs and research in this area largely remain male-focused and fail to address gender-related differences. For instance, national and international research, services, guidelines, and programs concerning people who inject drugs remain overwhelmingly gender-neutral or male-focused. What we need is more disaggregated data, for instance, in evaluating the impact of drug prevention interventions. Some initial data collected from UNODC, as I mentioned earlier, has indicated that family skills training is consistently benefiting both girls and boys more equally, more consistently. And so this is something that we've been working towards encouraging in terms of our prevention program that our health branch is looking at. We also need to implement specific measures to eliminate discrimination in the criminal justice system, provide gender-sensitive services for women who use drugs, including specialized prevention and treatment programs. And most importantly, I think we need to collect, analyze, and publish gender and age disaggregated data and evidence on drug offenses and the performance of the health and criminal justice systems in responding to these offenses, including the involvement of women, girls, and children in drug trafficking. I think it is sort of said in the UN that what is not measured is not addressed. And I think this is perfectly true, especially with regards to the issue of women and drugs. As long as there is not sufficient data or robust statistical indicators and so forth, it becomes very hard for us to then address this issue concretely. So I would say that the first step, one key step, is to begin work on the collection and analysis of data that is disaggregated by gender and age so as to form a good basis. And there's a lot of work that has already been done by the UNODC, the World Health Organization, indeed by other colleagues in this room, and I think this is a good start on which we can continue to push on this very important issue for a very important set of women, and also for all of our other sisters around the world. Thank you.
Thank you very much, Cynthia, for shedding light on this variety of topics. I turn now the word to Ms. Pervin Durgut from the Turkish Green Crescent Society. She has an undergraduate degree of pharmacy and an MA in public health. And she has been coordinating various national and international projects on public health since 2008. She was a project coordinator of tobacco control projects by WHO country office in Turkey. Since 2013, she's a consultant for the Ministry of Family and Social Policies of Turkey and a board member of the Turkish Green Crescent Society. Thank you very much. Thanks again. Before I start my presentation, I would like to express my pleasure for participating in such an important event focusing on gender issue. This topic is especially important because it is mostly ignored in studies with the exception of some developed countries. I came to realize this once again while preparing for my presentation. Substance abuse is a significant public health problem which extends to all demographic groups. Even though it affects women and men alike, substance addiction have been historically understood from a predominantly male perspective. Since prevalence studies, biological prevention, intervention studies may not address gender issue, it is quite hard to get a full picture of women's substance use and the problems associated with it. I would like to summarize very briefly the international literature on this problem. The available literature indicates that women are generally less likely than men to use illicit substances. Gender differences in illicit substance use being much smaller among adolescents. In contrast, women more likely to use pharmaceutical drugs both medically and non-medically. Because of physiological differences, there is evidence that women may become dependent more quickly on a number of illicit substances and may engage in more HIV risk behaviors and have higher mortality rates if they inject drugs. Psychoactive substances often affect and are affected by different phases of women's menstrual cycle. Substance use during pregnancy can result in low birth weight, early delivery, and poor nutritional status. It is observed that generally women with substance use problems have fewer resources in terms of education, income, and employment compared to men. They are more likely to be living with a partner with a substance use problem. They have more severe problems at the beginning of treatment. And women with substance use problem also have higher rates of trauma related to physical and sexual abuse and concurrent psychiatric disorders. We witness lack of studies focusing on gender-based risk factors, barriers within the scope of substance abuse in Turkey, as well as in other parts of the world. There is a great need for research focusing on gender-based risk factors, needs, and barriers. The Turkish Monitoring Center for Drugs and Drug Addiction, TUBİM, conducted a survey with 8,145 households in 2011. According to the results of the survey, lifelong drug abuse frequency is 2.7%. Ogel et al. Identified the drug abuse rate among women to be 10.3% and 89.7% among men in a study conducted in 7 regions of Turkey. When we look at different studies conducted in different time periods and hospitals across Turkey, we realize that drug abuse prevalence is lower among women than men, as is around the world. When we consider adolescents, study shows that lifelong drug use frequency is determined to be 1.5% in a study school children. 0.7% of the female students had tried substances, while this number was 2.3% for the male students. In terms of lifetime drug and current drug use, the values of male students were 3.9 fold greater than the female students. But since this study conducted among school children, I think the prevalence might be higher if they include all children, because dropping out from school is a risk factor for drug abuse. There are 28 substance abuse treatment centers all over Turkey, and these are not enough to accommodate everyone using drugs. The capacity of these centers is also insufficient for people using drugs. Several studies show that the number of women seeking treatment is lower when compared with the number of men. The fact that women use drugs less often than men does not necessarily mean less women should be in treatment process. Cultural values or stigmatization can be considered as reason behind the low numbers of women seeking treatment. For example, in eastern part of Turkey, the rate is 1 to 30, whereas it is 1 to 8 in western part of Turkey. According to scientists working in this field, this may be related to socio-cultural differences of the region. The number of women using drugs is increasing all over the world. That's why the approach should be changed so as to include women in prevention and treatment system as well. It is also observed that private treatment centers receive more women, more men, and less women using drugs. Yet the number of women applying to private treatment centers is higher when compared to the public treatment centers. There may be different reasons behind this, such as level of family, income, or education. According to data from 2014, 94.4% of the inpatients were male, while 5.6% were female. The substance treatment rates among women are extremely lower than men. The number of women referred to treatment centers has significantly increased over the last 3 years. However, there are no detailed data about the gender distribution of women seeking treatment in Turkey. The reason for low rates of women applying for treatment is rather controversial, because it is not certain whether the drug abuse problem is not common among women or women seek treatment less frequently. Data collected from different treatment centers in Turkey show that women apply for treatment mostly in case of intravenous injection. Ogel expresses that this may imply that women only go to treatment centers when the situation gets really serious. There are many risk factors for women, such as growing up in a family with mental problems or addiction, lack of social skills, friends with aberrant behavior, lack of problem-solving skills, lack of attachment among family members, etc. can be listed as some of the risk factors for women. But it is also striking that women who use drugs mostly have physical or sexual abuse history in Turkey too. Though there are really limited amount of studies regarding developing or underdeveloped countries, there are some obstacles for women in applying to treatment centers or remaining in treatment. Lack of collaboration among social service system, limited options for pregnant women, lack of culturally congruent programming, few resources for women with children, fear of losing child custody, and the stigma of substance abuse are only some of these obstacles before women. There is no comprehensive research on report focusing on factors which are perceived as barriers by women, both in applying to treatment centers and remaining in treatment in Turkey. However, we can say that similar barriers which are mentioned in the international literature applies in Turkey as well, according to oral testimonial of health professionals or working in rehabilitation centers. To deeply understand and reflect the situation, in Turkey we called 6 specialists from different rehabilitation centers and conducted a short survey over the phone. Now I will try to summarize the answers that we received from rehabilitation centers. The literature and the interviews I made with health professionals in Turkey demonstrate that high rates of trauma and physical or sexual abuse history are very common among women with substance use problem. So trauma and sexual abuse history should be addressed in women treatment period, and competent health professionals. Sorry. The rehabilitation centers that I contact reflect the same pictures in terms of the number of patients. All of them said that they receive more males than females. In Turkey, all treatment models have been developed on the basis of man needs. All the centers I contacted said that they do not provide any special gender-responsive services. But I cannot say that the centers have limited knowledge on gender differences in treatment process. As the number of treatment centers is inadequate, they are trying to provide services to maximum people with the limited capacity. They do not provide child care services for the patients with children. In all centers, it is forbidden for children to even get inside. Women are more likely than men to encounter multiple barriers to treatment entry, and this makes them less likely to seek care for their substance-related problems. That's why there is a great need for change in healthcare systems so as to include more women in treatment. As seen in the studies analyzing the inpatient qualities, men and women have different characteristics. The difference between women and men should be taken into account while designing treatment and prevention programs. There should be gender-specific treatment centers so that women would feel more comfortable in the place where they seek solution. Different examples from around the world show that women-only treatment centers are successful because there are experts who know how to deal with differences of women who come to treatment centers, so they are able to develop an efficient treatment program. It is also mostly the case that women have fewer resources than men and need assistance to develop economic self-sufficiency. This implies the need for social support system specifically designed for women's needs in building a life again. And the literature and the interviews I made with health professionals in Turkey demonstrate that high rates of trauma and physical or sexual abuse history are very common among women with substance use problems. So trauma and physical or sexual abuse history should be addressed in women's treatment period, and competent health professionals should be included in the treatment process. The interviews I made indicate that pregnant women are excluded from the treatment system. This may be due to lack of health professionals specialized in pregnant women's treatment. I believe there is a need for better structured treatment centers for pregnant women. This will surely better treatment outcomes. And there is a great need for research for both men and women gender-specific needs so a well-designed approach can be adopted. Thank you very much.
No.
Well, thank you very much. It becomes clear how much research is needed in this field and how many challenges there are. Thank you very much for making the service in Turkey to present it to us. Well, now we'll have the pleasure to listen to Reverend Cynthia Abrams. She serves as the Director for the Health and Wholeness and is a Special Advisor on White House and Congressional Affairs at the General Board of Church and Society of the United Methodist Church. In this capacity, she leads denominational efforts on global health, alcohol, tobacco, and other drugs. She is educated in broadcast journalism's divinity and is currently completing work on her